In this day and age, most every woman knows or is related to somebody who has been treated for breast cancer. Fortunately, even in my career, the treatments for breast cancer have gotten far, far better, which makes picking them up early that much more important. It starts as the cancer grows out of the duct, the milk duct of the breast, which is where most of them begin. It starts, and it grows through the wall of that duct. It starts to invade the tissues around it and distort them. And that distortion is what we don't see very well as the breast becomes more and more dense. We here at Freighter South we began doing digital mammography probably in about 2008, and prior to that it was film screen. And so then we went all digital and had several iterations of upgrade with the software for that, improving our ability to detect early cancers in more dense breasts. And then about 3 years ago, the next iteration of improvement came along, which is called digital tomosynthesis. Now, instead of taking an entire breast, we compress it, as every woman is familiar with, because we're trying to narrow the breast down. We want as little overlap as possible for our standard mammogram. So we compress the breast to try to layer everything out as the best we can, because we're shooting through that entire thickness of breast with our X-ray beam. And anything that overlaps each other can cause a potential false positive, if you will. So the breast tissue overlapping it can make it look like something that's really not there. When we come into the tomosynthesis realm, like I said, we're cutting the breast at 1 millimeter sections, and everything above and everything below that 1 millimeter becomes blurry, but that 1 millimeter segment is in focus. And as we march through the breast at 1 millimeter at a time, we wind up seeing the entire breast, because at some point, everything is in focus while everything else is blurred out, and that raises our sensitivity for the architectural distortion that tends to come along, particularly for invasive cancers. I have seen over the years, people knock off for a few years and something pops up, and you just think, if I had just seen this 1 or 2 years earlier, then we would be in a better situation than perhaps we are now. As I said, we're trying to, if we can find them early enough when they're curable rather than treatable, that is the ideal for us and for the patient as well.